Ernie from Croaky here, and we're at the National Nursing Forum in Hobart. We just had a millennial panel, and here I have the members of the millennial panel. There they are, live in action. And we're just going to do a quick run through because we talked about reducing the carbon footprint of the healthcare sector, but also wider climate health issues. So first, would you be able to introduce yourself?
Yes, my name is Melinda Goode. I'm a graduating nurse, so very new to the profession.
Fantastic. You have a background in
marine science
and
development planning. Yes.
That's a good combination. Now they've gone dark on us here. So anyway, we'll try and persevere. What are the issues that worry you most in terms of carbon footprint or climate health?
Yeah, so for me, it's that the hospital's contributing, well, hospital and pharmaceuticals mostly, but the healthcare system broadly is contributing 7% of Australia's carbon footprint, and yet we're there to treat the people that are at their most vulnerable, at their sickest. We're also contributing to the problem. So for me, that's something that really doesn't quite sit well.
What's your big ask of the healthcare sector or the profession?
I think
who can do something?
I mean, we've got so much we can do from a ground level, and my colleagues might talk about that, but for me, systemically and from a policy, change needs to come from widespread policy. We need to be having the tough conversations. We need to be asking the tough questions. Why do we do things the way we're doing them? Why can't we do them differently? Why isn't climate change one of our priorities?
And can I ask, do you raise that at work, and does it go down well?
Like I said, I'm a graduate nurse, or a graduating nurse. So in my previous life, it's always met with a little bit of resistance and can be met as, you're just one of those greenies. But I think, and I'd like to think that now we're seeing some of that change come through, and that language and the attitudes are becoming less and less. So I'm hopeful.
Great, thank you very much.
Thank you.
Okay, going to Nick. I'm going to put you on the spot too, Nick, if I may, after you've introduced yourself.
Sure, so my name's Nick Hayward. I'm also a graduating nurse, so almost finished my undergrad, and I work as a nursing assistant in Sydney.
Fantastic. You talked about culpability, so let's look at that.
Yes,
what were you saying?
So I guess my message is that inaction has persisted for so long now. It's past the point for niceties. We're well past the time when it's appropriate to be polite, and that was what triggered that comment about culpability. Was a question from the audience saying exactly the same thing. I don't think we have time left to be nice about climate change.
And you're talking as well, community members, all of us as citizens, but you're talking about the profession and the healthcare sector.
Absolutely, because as nurses, we see people, as Melinda was saying, we see people at the most vulnerable, and if we're not out there advocating on the ground level and at a systemic level in terms of changing policy, make recycling opt out. Hospitals shouldn't be allowed to generate as much waste as they do without responsibility, without being taking responsibility for where that goes and what happens to it. So absolutely, as nurses, I think we have a key role in terms of promoting healthy communities and a healthy future for the next generation, for our generation, and that starts with having the conversation like we have today.
And is there something that you would immediately say that should be done?
So my bugbear that I mentioned in the panel is food waste. Absolutely kills me. And
in healthcare?
In healthcare. And I mean, there's a massive conversation about waste generally, which we talked about in single-use products and so on. But the food is a particular one for me. I think if I was in a position of power, and I've tried raising it unsuccessfully at my workplace, but I would look at where we can take that food. Are there rough sleepers that can have those meals that aren't eaten? Can we compost it? Can we start a garden? Can we turn it into something beautiful and productive instead of putting it in landfill? It seems to me like an opportunity that is just wasted.
What do you put that lack of interest down to?
Good question. I think for me, it's not giving a voice to people like us, and we've had a great opportunity today to really share that voice with people here in the audience. Not empowering the agitators to come up with ideas for change, and then just resistance. And Catelyn mentioned this in the panel. There's an education piece. People need to learn what happens to waste, what happens to produce the things that we use, and why that's affecting us, and what happens if we don't do anything. At the moment, it's pretty dire.
Fantastic, thank you,
Nick.
Nick.
You so much.
Now, Catelyn, hi. You did talk about education, but would you introduce yourself first?
Yeah, so I'm Catelyn. I am a registered nurse. I'm in my third year of practice in Melbourne, originally from Tasmania. So, yeah.
And what's worrying you on the carbon footprint, healthcare sector, general climate health?
I thought Nick would talk about this, but I think one of the things, because he didn't, one of the things I'm really concerned about is that, and I'll add my voice to this, is that young people aren't being sort of involved in these conversations. I don't think we would be seeing teenagers and students striking if they're included in the conversation. So I think that's a really, really big issue and a missed opportunity, is that we have a large body of really passionate people, include them and start sort of setting them on this scavenger hunt for solutions.
And you're saying that to healthcare providers?
I'm saying that to healthcare providers. I'm saying that to anybody that's... I'm saying that to everybody, I think, is the message I'm sort of trying to convey, is that, myself included, is that we have people that are passionate and saying they're passionate. So if we're hearing those messages, then we should sort of be acting on that and really encouraging those voices.
And as somebody working on the ground in this, or working on the wards, what have you seen that you think could be really easily fixed?
One of the things that I sort of talked about, or that I am a massive proponent of, is improving our education and marketing that education. We have some really good research out there, but it's not being heard because we sort of need to be focusing on how we're marketing those messages and getting them across. So I think that's a really good opportunity, and it's something that is easily doable in our workplaces if we can sort of look at what's being done in other workplaces and then transferring that across to our sort of organisation. It's a good opportunity.
Fantastic. Thank you very much. And I'm just going to whiz around to Luke. Luke, can I maybe get you just to pop over there? So we've got the background. Thank you very much. Could you introduce yourself?
Hello, my name is Yokota. I'm a registered nurse that works in Brisbane, Queensland.
Thank you very much. And I'm going to talk to you about two things, but let's stick first with carbon footprint and climate change. What's the biggest thing for you worrying about that?
Sure. So the biggest thing is waste. And as I spoke on the panel about single-use items, and even the background behind that is that single-use items actually become more cost-effective in actually finding a sustainable solution. So that's one of the big issues.
And what would you like to see done structurally and or at the place level?
I mean, this may be, don't want to sound too radical, but we need to make more beneficial, be cheaper to be wasteful, because that's the main thing, where we have a system in place which is used to benefit many parts of our community, but this particular system is still benefiting within waste. It's maybe making our healthcare cheaper in the short term, but overall, if we continue hurting everything that we put into the environment, that's going to inevitably affect our health. If that be through pollution, waterways, and then the cost of healthcare is going to be impacted anyway.
Fantastic. Thanks very much. We might do the other one in a separate one, yeah?